Hello, everyone. Thanks for joining us for this Medicare Part B in the Ambulatory Surgery Center ASC webinar. My name is Mary Moko. I'm a specialist on the Provider Outreach and Education team at WPS. I will be your speaker today, and assisting me is my friend and colleague, Ellen Barra. We include this disclaimer in all our education, and we do so to remind learners that although we made every effort to provide current information that is correct, the information is subject to change. It is on the CMS website where you will find the Medicare rules that determine final coverage. These laws, regulations, and rulings will always prevail. We will provide responses to questions received based on the facts given. And finally, CMS prohibits recording of this presentation for profit-making purposes. We are recording this webinar and we will post it as an encore presentation. You can stay informed about new postings of the latest encore presentations and other education events by reading the education news that we post each week on Wednesday. Here is the agenda for today's overview of Part B billing in the ASC. And just as we advertised, this webinar is really intended as a basic introduction for Part B ASC services. I will discuss background and provide some information about enrollment of ASCs in Medicare Part B. I'll provide coverage basics and share some claim submission guidelines, including the use of modifiers. And I'll discuss documentation to assure proper payment, as well as the payment to ASC facilities and the costs involved. I'll also share many useful resources throughout my presentation. If you take a look at your presentation materials, you will see that I have actually embedded the links to those resources in the handout. And finally, this webinar will conclude with some presentation-related questions and answers after I finish my prepared remarks. At the end of this presentation, you'll understand how Medicare Part B covers and reimburses ASC services that are submitted to Medicare Part B on a Part B claim, a 1500 claim form, or the electronic equivalent. You'll also know where you can find the WPS and CMS resources to help you submit correct claims in order to receive correct payment. And I think that it's fair to say that this is a goal that we all have in common. It's really a win-win for both providers and for the Medicare program when you submit correct claims to receive that correct payment from Medicare Part B. Now, to receive coverage of and Part B payment for its services, a facility must be certified as meeting the requirements for an ASC and must also enter into a written agreement with CMS. Now, CMS defines an ASC, or ambulatory surgical or surgery center, as an entity that operates exclusively for furnishing outpatient surgical services to patients. And as you can see here on this slide, the duration of services, with few rare exceptions, is not to exceed 24 hours. ASCs are subject to statutory, regulatory, and compliance requirements. You can find conditions for coverage in 42 Code of Regulations, and it is Part 416. And you can see here that I've embedded a link to this as well as to other resources in your handout. You can find the CMS guidelines for ASCs in their Internet-only manual, publication 100-04. That's the Medicare Claims Processing Manual. It's just one of many Internet-only manuals CMS has published on their website or has available for download. You can see that Chapter 14 is the chapter that applies for ASCs. And again, that link is embedded for you, so you can quickly and easily find that information by clicking on that link in your electronic handout. The Ambulatory Surgery Center survey is conducted, and it's done so in accordance with appropriate protocols and those substantive requirements listed in that statute and regulations that I talked about on the previous slide. Survey protocols and interpretive guidelines are established to provide guidance to the personnel that is conducting those surveys. They serve to clarify and or explain the intent of the regulations so that all providers that are required to use them can understand them easily, and they can access the compliance, or assess the compliance rather, with federal requirements. You can find guidance for surveys for ASCs in Appendix L of the State Operations Manual, and that's available out on the CMS website. I'm going to show you really quickly how you can get to this information. Slide the screen over. It is the CMS website that you should be seeing now, or you are seeing. This is the CMS homepage, and in order to find those CMS Internet-only manuals, scroll down on the homepage and choose this far right arrow. That will drop open for you a list of manuals, forms, and transmittals. And we're going to take a look at the Internet-only manuals. So I'm choosing Internet-only manuals. And it is the State Operations Manual, publication number 100-07. That includes, let me go back here, the Appendix L. So I'm going to look under Appendix to find those that guidance for surveys. So if you're looking here in the appendix, I'm going to choose L, and that is the Ambulatory Surgical Services Interpretive Guidelines and Survey Procedures, done right here. You can see there's part 1 that lists the ASC survey protocols, and part 2 provides the general provisions and definitions, those conditions for coverage. Okay, specific conditions for coverage. You're going to hear me talk about those a little bit later on in today's presentation. All right, back to the PowerPoint. The IOM guidance for ASCs, as I previously mentioned, is found in Chapter 14 of the Medicare Claims Processing Manual. And to access that manual, you would do the same thing that I did for that State Operations Manual. Go to the CMS website, on their homepage, scroll down, and on the far right center of the page, you can use a drop down for a menu of manuals and transmittals, and you would choose the Internet-only manuals to find this. But you won't need to take all of those steps because I have included an embedded link to that chapter in your handout. So the guidance for CMS's guidance for ASCs is really summarized here on this slide. ASCs can be a fixed location, or they can be a mobile unit. They can't share space with another entity. CMS will allow 2 ASCs to use the same space, but only if each is an entirely separate operation with separate records. So in addition, they cannot be open at the same time. It's important to recognize that state regulations are not always the same as federal regulations. So rules for an ASC in Michigan may be different than rules for an ASC in Indiana or Kansas or any other state for that matter. CMS expects that services performed in an ASC will not be too risky for the patient to receive. So again, I mentioned this earlier, with very few exceptions, there is no overnight stay. There are 2 types of ASCs that can enroll. They're listed here on this supply. Independent, or on this slide rather. It's independent or a hospital ASC. An independent ASC is just as that name implies. It's not part of a provider of service or any other facility. A hospital type ASC is one under common ownership, licensure, or control of a hospital. Now, ASCs can choose options under which to bill. Some ASCs choose to bill only for the ASC facility charges, and the surgeon independently bills. But some ASCs choose to bill both the facility and those professional services or the surgeon services. Let's talk a little bit about Part B enrollment. That process is designed to make certain the ASC meets both federal and state requirements. And as part of the enrollment process, as I mentioned earlier, CMS conducts a survey to make certain the ASC meets those conditions of coverage. I talked about those before. I pointed those out to you, those listed and found in both the Code of Federal Regulations and in the Addendum L that I showed you earlier, the Appendix L of the state operations manual. Now, both CMS and WPS maintain web pages to help facilitate successful enrollment. I'm going to show you where you can find some of that information on the WPS website. If you are on the WPS website, this shows it here. I'm going to make this a little bit larger so that you can see it a little better. This is the homepage of the WPS website. A lot of great information here. Of course, you can use the search box up in the upper right-hand corner to navigate or to search. I like to search better than I like to navigate, but when I'm demonstrating the website, I need to make certain you know how to search and to navigate. So we have on our website various topic centers. I'm going to select that up here in the top. And you'll find various topic centers that are found in our website or in our portal. And right here, provider enrollment is the one I'm choosing now. And this is where you can find those guides and resources that I just mentioned for successful enrollment in Medicare Part B. A lot of great information here. All things related to provider enrollment. So this is how you would find them. You can read about reassignment of benefits, electronic provider enrollment. You know, there's internet-based provider enrollment. That's the provider enrollment chain and ownership system that CMS has designated as the system that will be used for enrollment. A lot of great information here. You can also link to some of the forms that you'll need to fill out when enrolling with Medicare. So upon successful enrollment, an ASC is assigned a provider specialty code. These are two-digit codes. There's a list of them out on our website, but there is a two-digit code assigned by CMS for each of many provider specialties. Sometimes new specialties are added, so you'll need to take a look at that. But this specialty designation is really what drives the payment methodologies and the claim edits that occur during claim processing. So that provider specialty code is really what's going to drive that ASC payment methodology. It's also going to drive those edits or those audits associated with ASC claims, those claim edits that are built into the claims processing system. The two-digit specialty is the only specialty that is used during initial claim processing. All right. The CMS ASC Center includes links to a variety of ASC topics, including manuals and educational resources. A link is embedded in your handout. This is what it looks like if you actually go to the ambulatory surgical center out on the CMS website. And again, a link is embedded in your handout. Links to transmittals, internet-only manuals, so all things ASC. CMS has placed here in their ASC Center or on their ASC Center website. You can see information pertaining to coding and billing. There's some educational resource links here. There's other ways you can stay informed by subscribing to one of CMS's newsletters or open door. There's open door forums that you can attend. You can sign up for some of their listservs. You can see that on this ASC Centers page, CMS has already kind of categorized the different kinds of help that you might be looking for, the different kinds of information you might be looking for. This section here, right in the center of the page right now, is information that pertains to enrollment and participation, those conditions of coverage, remember, that I talked about. There's a quick, easy link to them. There's also information that pertain to ASC policies and regulations listed here at the bottom of the page. So a lot of great information that CMS has brought together into one handy web page, or onto one handy web page. All right, I already mentioned to you the provider enrollment guides and resources that are found on the WPS GHA website. There's also some great videos available in our YouTube channel. If you've never looked at our YouTube channel, I highly recommend that you do so. We have many playlists. Here's an easy way to get there, if you spell it correctly. I'm going to the YouTube homepage. And to find the WPS GHA YouTube channel, I'm typing in WPS GHA in the search box, and I'm going to hit enter. I'm going to go right here to where I see the logo, current logo. And what happens, and what you just heard, was this introducing WPS video automatically starts playing. I just stopped it. It comes up kind of loud depending on how loud you have your volume set, of course. So this is where you can find those playlists that kind of categorize the various videos. Uh, uh, Video topics, if you will, that are out on your website. You can see we have a playlist for the interactive voice response system. Over here we have health equity, wound care. We have a playlist of telehealth services, one for enrollment, if I can find it here. There's education and training, evaluation and management, which of course wouldn't pertain to your specific specialty. I'm looking for the provider enrollment, and I'm probably looking right at it and looking past it. What I'll do is I'll just show you an example of the Ambulatory Surgical Center playlist. I'm going to choose View Full Playlist, and you can see that there's actually 2 videos out there at this time. As we add videos to our YouTube channel, you'll see this list expand. Now, there's 2 out there for ASC services, but I will tell you that for things like provider enrollment, you might see as many as 40 videos in our playlist. So some great information available on the WPS GHA YouTube channel, and I'm certain that I have that link within your handout somewhere if you want to go directly to it versus navigate to it like I just showed you. So these are some great resources. Another great way to find our YouTube channel in a hurry is going to the WPS website. I'm going to move that over. Here's another great tip for you if you're looking for education that WPS has published. Go here to the top of the page, middle of the page. It's the Training Center. If you select it, you can link to our live events. Here's our calendar of live events. Here is where you can link to our encore presentations. Recording of this video, or recording of this webinar, will be available in a few days out here under encore presentations. It'll also be available on our YouTube channel. So this is how you can go directly to our YouTube channel. There's other information here out under the Training Center that if you get a chance to, I would highly recommend you take a look at it. We have some specialty training and resources, ways you can partner with us. If you belong to an association or a society, you want to invite a WPS staff member to speak at your conference or meeting, you can do so by checking out Partner with Us. And here's where you can meet our team, and so on and so forth. So a lot of great information there in the WPS GHA Training Center. let's get back to the PowerPoint here and talk a little bit about coverage. It is on the CMS website that you will find the list of approved HCPCS codes, CPT codes, and payment rates for ASC services. CMS publishes these in an annual and quarterly ASC fee schedule and drug file addenda. These downloadable files are listed under related links and they are arranged by date. I'll take you to that page now and should give you a look at what that looks like. This is that ASC Payment Rates and Addenda page. And what you'll need to do here is pay attention to the quarter during which that information was published so that you are selecting the right link to view that list of approved HCPCS codes and the payment rates for ASC services. So obviously for services now that are performed January or July of this year and forward, you would use this link. CMS will add the next quarterly link when that information becomes available. Now, when you select this, what's going to happen is you will actually open up a file that you're going to need to unzip. I'm going to go over here on the other page and open that. I had it open, but I must have inadvertently closed it. Okay. Bear with me. Just pulling something open on the other page. Trying to do the unzip over here so that it will go more quickly. Okay. Almost there. Hang in there, folks. Accept. I have to accept the licensure agreement, of course, whenever I open something on the CMS website. And I'm unzipping the file so that I can view at last the Excel worksheet. All right, and I'm going to pull it over so you can take a look at it. This is what those files, the addenda AA, which shows the list of covered HCPCS codes for ASC services. I'll make this a little bit bigger here. If you're looking or you want to search, you can just click on column A, hit Control and F, and look for a particular code to see if it's on the list of covered ASC services. And sure enough, for the code that I entered, it does appear on this list. So that means Medicare can consider payment for this service when it's rendered in an ASC, and the payment indicators are here, payment weights, and so on and so forth. Now, this particular webinar is really designed as an overview. It's an introduction, so we're not jumping into what each of these columns means, but this is the information you will need in order to see pricing methodologies or pricing information rather for ASC services. Okay, back to our PowerPoint. Now here's a list of the items and services for which Medicare includes in the payment to ASCs, and these items and services are those that can be covered when rendered in relation to an ASC covered procedure. So if we're not going to cover the procedure, then of course we wouldn't cover payment for these services for which payment is included to the ASC. Reimbursement of these services on this slide, you could see use of the facilities, drugs, biologicals, we have therapeutic items and services, all of those administrative or housekeeping items and services, all of the nursing personnel, technical personnel services, and of course those people must be employees of the ASC. The payment that Medicare makes to the ASC for the facility services includes all of these services. Here's a couple more. This is just an extension of the list that I just showed. That is payment for these items are also included in the Medicare payment made to an ASC for a covered service. So of course, remember that related surgery is going to be one that appears on that list of covered procedures that I just showed you. So reimbursement, Medicare's reimbursement, Medicare Part B's reimbursement actually is included as part of the facility fee payment when materials for anesthesia are provided, blood, plasma, platelets, and intraocular lenses. So I just talked about those services and items for which payment is included for the ASC, there are also some services that are not included in that facility fee, and those would be separately billable. Now, sometimes some of the services are going to be separately billable to another contractor, like the durable medical equipment Medicare administrative contractor, for prosthetics. So the physician services for those services rendered in the ASC are not included in the facility fee. That would be a professional service separately billed. Sale, lease, and rental of the durable medical equipment for use in a patient's home would be covered by the DME-MAC. Prosthetics would be DMAC. Ambulance services are not included in an ASC facility fee, as well as braces and artificial eyes, arms, and legs. And also independent laboratory services, those would have to be separately billable. Now, Medicare will consider separate payment for certain ancillary items or services, such as those listed here on this slide, and those examples include brachytherapy services. Medicare can also make separate payment for certain implantable items with pass-through status under the outpatient prospective system, or payment system rather. Outpatient prospective payment system. I have to spit that out again. It's the OPPS. You'll hear us refer to it that way. It's much easier than saying outpatient prospective payment system. Now, other services for which separate payment can be made are certain carrier priced services, and the example provided here on this slide is the procurement of corneal tissue. And remember, anytime there is a carrier priced service billed to Medicare, Medicare is going to be asking for documentation. So you'll need to make certain you let Medicare know that documentation is available upon request. You'll need to submit all of the documentation that pertains to pricing for that particular item or service. For those of you that do submit services that are covered and reimbursed as a carrier priced service, you might want to consider looking into oh gosh, let me find the article here. There is an article on our website. There's a great article on our website. I'm going to pull it over and show it to you now. This is something for you to consider. Now, you won't have this particular link in your handout because I didn't put this information in your handout, but I think it's important to talk about it. This particular article titled Additional Documentation, Ways to Reduce Your Burden. I'm not certain Ellen will be able to drop that link into the chat, but if she's able to do so, she will. This talks about when you bill and describe NOC codes, or when we price carrier priced codes. And here was the verbiage I was trying to think of, and it wouldn't come to me, but I knew it was in this article. If you submit claims to Medicare for carrier priced services or items, consider this PWK, or learn more about PWK if you're not familiar with it. This is a segment, just like it says here, in the electronic claim, and it provides a link between an electronic claim and additional documentation that's needed for claims adjudication. When you follow this process here, you put what you need to in the various loops or segments of your electronic claim. You can, as soon as you know that claim has come into Medicare and been accepted, you can submit that documentation through a dedicated process. We will image the documentation and have it available during initial claim adjudication. You don't need to wait for that additional documentation request letter to come. This is a huge time saver, folks. We will have that documentation right then and there when the claim is adjudicated. We don't need to send you that letter, wait for you to get that letter, and then wait for that documentation to come in. Now, if you wait until after that ADR letter, that additional documentation request letter, is received, it's too late. You need to do this at the time your claim is submitted. So this is just a really fantastic time saver and money saver. Additional documentation, ways to reduce your burden. If you want to do a quick search on our website, you might want to consider searching PWK. And I neglected to tell you that PWK stands for paperwork. All right, back to the PowerPoint here. All right, so we talked about coverage for ancillary items and services. Here's some more information about other ancillary items and services for which Medicare can make separate payment. Remember that these items or services must be integral to the covered procedure. Those listed here are certain drugs, biologicals, and radiology services. And all of these, again, are those for which separate payment is allowed under the Outpatient Prospective Payment System, OPS. Contractors pay ASCs a reduced amount for certain specified procedures when that specified implanted device or when a specified implanted device is furnished without cost or for which either a partial or full credit is received. This is familiar, really known as none other than a device recall, for example. So sometimes the ASC is going to implant a device and they're going to reduce the price, or they're not going to charge for the price because there was a device recall or a malfunction and so on. So in those situations, when there's implanted items that are furnished without cost or at a reduced cost, ASCs are required to include modifiers on claims. And an FB modifier that's appended to the procedure code when a specific or specified device is furnished without cost tells then Medicare how to price that particular claim. And there are links within the annual policy files, those that I showed you earlier, that show how those costs affect the payment. Now, if the ASC receives a partial credit, 50% or more of the cost of the specified device, then the ASC must report the modifier FC on the procedure code. If that procedure code is on that list of specified procedures to which that FC reduction applies. And you can find that again in those annual policy files. I've provided the web page for you. Now, that said, a FB means that a service is provided without cost, as you can see on the previous slide right here, without cost. And then if there is a reduced cost, 50% or more, you would need to apply the FC. So it only goes to say, folks, that you can't submit a claim with both an FB and an FC modifier. Now, there are tables that list the devices to which the payment adjustments apply, those full and partial adjustment amounts, and they are in those annual policy files that I demonstrated earlier. There is Section 1833 of the Social Security Act, and this addresses coverage for what CMS calls pass-through devices. Certain newly FDA-approved drugs, biologicals, and devices are designated by CMS as having pass-through status. When this status is granted, CMS designates a HCPCS code to use for billing. It's usually a temporary code. It usually allows payment for that pass-through product or item for about 2 to 3 years. And once this period expires, CMS will either remove it from the pass-through list, or CMS will assign a permanent HCPCS code, at which time it may be considered under the facility payment for the procedure. So for these devices and drugs, a 20% copayment does apply. And to look for those devices and drugs with pass-through device pricing, you need to look for a J7 payment indicator on the ASC Payment Rates Addendum BB. Let's see if I can find that for you and put it out here. For some reason, I keep closing these and I shouldn't do that. I should leave them open and just drag them back to my other monitor. So we are looking at ASC pricing files. Here, I'm pulling it over now. Thanks for your patience. Here we are. I'll just show you the steps this time since I know this is moving rather quickly. I'm going to be looking to see that J7 payment indicator on the ASC Payments Rate Addendum. So I'm going to open the pricing file for the current quarter or the quarter for which my date of service on my claim shows. I'm going to open the file and it's going to open. I need to unzip it. Which it did on my other screen. Okay. I talked about the surgical procedures when payment is packaged, the pricing files for all of the ASC covered surgical procedures. And Addendum BB is the one where you would look to find the J7, and here it is. So this would be those services then that CMS has deemed as pass-through devices when in column E, I'm going to scroll quickly to the top, when column E shows the J7 indicator. So I'm doing a find for J7. So anything with this J7 indicator on addendum BB, you can see the tab is called BB, those are pass-through devices. Okay. So temporary codes assigned to those services for 2 to 3 years. Those are pass-through devices. Okay. Let's talk a little bit about the payment for those pass-through devices. That's here on this slide. The information on this slide pertains, just as I mentioned, to pricing for those pass-through devices, those on Addenda BB. Of course, the links are shown here. I did show you what it looks like when you actually open them. You would look in Addenda BB, of course, for that J7. And we do have a resource on our website that addresses what are pass-through payments, pricing for pass-through payments, and claim submission guidelines. And again, that's on the WPS website. I'm going to pull that open and show you what that looks like. And the name of the article is Ambulatory Surgical Center Pass-Through Device Claims. Talks a little bit about the definition of what is a pass-through payment, pricing for those services, and then it talks to you about what you need to consider for those carrier price procedures. All of these are going to be carrier price procedures. They're pass-through devices. They're assigned a temporary code. They're usually a new drug or a new item or service that CMS assigns that temporary code to. I already talked to you about PWK and what a great way it is to save you time and money. Right here is more information about the PWK segment. If you know that you're billing for a carrier price procedure, if you use this this PWK, that paperwork segment of a claim, to alert us that you have documentation and you follow the steps correctly, you can save time and money. Okay, all right. Back to the PowerPoint. This tells you that for those pass-through device claims, you need to enter invoice details in item 19 or the electronic equivalent. And that article that I just showed you really kind of talks about that way and what you need to include on the claim. All right. I want to talk a little bit about terminated procedures. Medicare does make payment when a surgical procedure is terminated due to the patient having medical complications, which would put them at risk if the procedure were continued. Claims that involve a terminated surgery must be accompanied by an operative report, and it must include all of the information here on this slide. Explain the reason why this service was terminated. Describe what you did do. Describe the supplies you used or those that you expected to use had the surgery continued, so on and so forth. You can see all of the information we need for terminated procedures should we need to review your documentation. The expectation is that all of this information would be included in your documentation. So there are certain modifiers reported on the claim, and it's going to trigger the correct payment when procedures or planned procedures are terminated. ASC should append modifier 73. This reports a procedure that's terminated before the administration of anesthesia. In those cases, Medicare will allow the appropriately documented service at 50%. Use modifier 74 to report those procedures that are terminated after the administration of anesthesia. When you do so, Medicare will make full payment when that terminated procedure is properly documented. There's a couple of other codes that would be reported on the surgeon's claim. Well, in this case, we're talking ASC today, but I do want to make mention that when these situations happen, physicians would report modifiers on their professional services too, either the modifier 52, which is that reduced service, it's expected or elected to be reduced or terminated, versus the 53, which is for those that are unexpectedly terminated due to the risks of continuing that procedure. So terminated procedures would require modifiers when you submit those claims. We do have an informative resource on our website. It explains how Medicare calculates the payment for terminated ASC procedure, and it also provides details on what you need to include in that operative report, as well as how to submit your documentation to Medicare. Medicare can make payment to the physicians who perform the surgical procedure and make payment to the ASC for the facility costs. A correct claim does need to be submitted in order to receive proper payment. Some things to consider: do not report separate line items for those items or services for which there is no separate payment allowed. Some of those slides that I showed you earlier had a list. These items or services are included in the facility payment. So we would not want you to separately report those items or services when there's no separate payment allowed. Of course, you would need to report the ASC surgical procedure code on the claim. You would need to report any covered ancillary items or services that are separately payable. You would also need to report any pass-through devices, and remember those are listed on addendum BB with that J7 payment indicator. This would of course include or also what you would need to consider when submitting claims is to separately report those brachytherapy sources. You would use place of service 49 to indicate the surgical and diagnostic services that are performed in an ASC. If a patient is in a Part A covered skilled nursing facility stay, when that surgery is or occurs in the ASC, it is not a Part B service. I'm going to repeat that. If a patient is in a Part A covered skilled nursing facility stay, when brought to your facility and when that surgery occurs there in the ASC, it is not a Part B service. The SNF, that skilled nursing facility, would then be responsible to bill for the services that were rendered at the ASC. So you would need to have a contract with that skilled nursing facility when you render services to their patients or patients that are in a Part A covered stay at that facility. You would use, of course, a technical component or a TC modifier for facility charge services if applicable. So those things that I just talked about really pertain to what we call SNF consolidated billing, or SNF CB, you might hear us say it. There are a number of informative videos out on our YouTube channel that you can check out if you need more information about those services, SNF consolidated billing. And of course, when you are preparing your claims, remember to report any applicable modifiers for use of the advanced beneficiary notice of non-coverage. Though that would be for those services that you believe the likelihood that Medicare Part B will deny your services because they are not considered by Medicare to be, or they don't meet Medicare's medical necessity guidelines. So if you are preparing or presenting an ABN to your patient, you need to consider reporting the correct modifier, which really assigns financial liability to that service. You need to report that on your claim. Now, CMS publishes files that include the procedure codes. We actually took a look at that for those surgeries rendered in the ASC. The link is here. These files do assign, I talked about it a little bit earlier, but I didn't delve into it. They're going to assign a payment group code to each of those procedure codes, and it is that group code that determines the amount that Medicare pays for the facility costs. And again, as I mentioned earlier, this is really designed as a kind of an overview, so we didn't do a deep dive into it, but there are those payment group codes that assign the amount that Medicare will pay the facility for the facility costs for each of those services. So this then includes the prepared remarks that I had to talk about ASC today. Before I open up for questions or take a look at the questions, I do want to share this information with you about an in-person annual conference that CMS and Noridian Healthcare Solutions, another one of the MACs, is teaming up to host. The purpose is to educate the provider and supplier community about multiple provider enrollment aspects. This is coming up soon, folks. It's on August 28th and 29th. The times vary day by day, or vary from day to day. It's going to be held live in San Diego, California. There's a link included here on this slide for a description and schedule and to register for this. The cost is zero. It is free to attend this CMS sponsored conference. However, of course, your travel expenses and such will be on your own. So this then brings us to that section where we will take some questions, and I am getting that ready here. We have had some technical difficulties we discovered at the very beginning of this. So Ellen has been able to enter information into the chat, but she's not able to speak to me. I can't hear her, so I need to do some troubleshooting. So she has asked you to place any presentation related questions. Remember, following today's event, we're going to have that survey available for you. This will give you an opportunity in that survey to talk about those or to mention to us those topics that you would like us perhaps to delve into or to cover. So I'm looking at the chat and I'm seeing a question that says, if there is clinic space on the first floor, place of service 19, and the ASC is on the second floor, same address, how do we enroll in the 855 to include the ASC? The first floor is already enrolled. Do we need to enroll in the second floor in addition? That's a very good question, and it's really kind of an enrollment question that I honestly do not know the answer to. That was submitted by Kayleen, and what I'd like to do, Kayleen, is to tap on the expertise of one of my provider enrollment contacts or colleagues, I should say, someone at WPS that works in provider enrollment, that I can get that specific provider enrollment question answered. So I'm going to follow up on that one. I'm looking to see if there's any other questions. Items included payment to the ASCs. It does not indicate anesthesia services. Do ASCs submit fees for the administration of anesthesia, but a flat fee? That I don't know that I think that those services are included, but I'm going to have to follow up on that. I may have just dropped that from the list of items and services when I typed out that slide, Nancy, and I apologize for that. I'm pretty sure that the services are included, that administration and anesthesia, but again, that's something I'm going to have to follow up on because it was not on my list and it should have been. So I have a feeling that I may just have dropped that off inadvertently, and I apologize, but I want to make certain that I'm answering you correctly, and I'm going to come back. I'm going to circle back to that and make certain that I get back to you. And I'll share that not only to you, Nancy, but with everyone, whether the anesthesia services are included or not included. And I believe they are, but I do need to verify that. And that is all for the questions that I am seeing submitted. You know, our greatest compliment is when you recommend our education to others. Please help us reach all of the providers in our jurisdiction by helping us disseminate our education to others and by recommending our education to others. On behalf of myself and Ellen and all of the provider outreach and education team, I do want to thank you for participating. We look forward to your survey comments, and we hope to have you join us for future events. You may now disconnect. Our webinar is complete. Thank you.